Silvia, tell me first of all, there is terrible news coming out of Italy every day, and Bergamo is at the centre of it. What is the situation right now?
I work in Bergamo. I'm a medical doctor and I'm a health director of a hospital in Bergamo. The situation, I can say, exploded towards the end of February. Myself, I did the first test for coronavirus in a nurse that was working in our nursing home for elderly people on the 26th of February. And after 5 days, we got the result. It was positive, but already 6 or 7 elderly people started having fever and pneumonia in that nursing home where the nurse was working. And from there, it exploded everywhere. So we did not have enough time for preparedness. And we had to deal with the emergency situation that really exploded in few days. And now the cases arose in the past 2 weeks, and still there are new cases, but I hope we'll reach a plateau, hopefully next week.
I mean, you use the word exploded. That is exactly right. When you think that your first case was only on the 26th of February, and yet we look at the terrible death rate coming.
That was the first identified case because the nurse had fever on that day, and I asked her some questions and discovered that she was in contact with a person whose mother was admitted in a hospital close to Bergamo because of the virus. So I decided to do the test, and that was the first identified case in my hospital.
From your perspective, why do you think it has taken a grip so quickly? Is it because, as you said, you weren't prepared? Is it because of the elderly population? Why do you think it has taken such a fierce grip in your area?
I think only later on we could maybe understand why it happened like this. After China, we had cases in Lodi and Cremona, that are 2 cities in the northern area of Italy, 100 kilometers and 70 kilometers respectively from Bergamo, and then Bergamo. And now Brescia, which is like 30 kilometers from Bergamo. It's difficult to understand why in those cities, especially. We know that since the mid-February, the cases were increasing in that area, in Bergamo area. But still there was no rules and norms limiting the movement of the population. So the population continued moving around, and the cases were increasing. When all the measures were taken, it was good, I think, for the rest of Italy, Milan and other cities, the rest of Italy. But unfortunately, Bergamo area, and like other cities, Lodi, Cremona, were already affected. So for us in Bergamo, it was too late. I hope for the rest of Italy and for the rest of the world, this experience would teach something, so you will be able to act promptly and earlier. And because the only thing to limit the virus is to limit the movement of the population, because even in our hospital, we limited the people entering the hospital only for urgent visits. We limited visits to inpatients. We did a triage at the entrance of the hospital to see if people had symptoms or contacts with positive cases. We tried our best to prevent, but when you have the virus spread all over, around in the neighborhood area and in the city, then really you can't control it, because even the health workers, they live in the same place, they get the virus at home, they get the virus everywhere beside the hospital.
And so what has been the impact on the hospitals there on health workers like yourself? How have they managed?
Of course, there is a lot of work to do in this moment. We are using personal protective equipment, but like some health workers, like myself, I was one of the first one to get the virus. I cannot say why I got it because I used the mask and the gloves and all the protective equipment to visit the people. But what I can say is there are some people that are asymptomatic or with mild symptoms, and some people are your colleagues, even medical doctors, nurses, your colleagues in a healthcare facility. So when you are with them, usually you don't protect yourself enough because you feel safe. So the only thing between colleagues or people is if you feel sick, you have fever, you have something, you need to stay home immediately because when you have symptoms, you can spread the virus. So usually when you get some fever, you take some pills, tablets, and then you go to work. In this moment, everybody should avoid it. If you feel sick, you have fever, you need to stay home immediately because otherwise you can transmit it to other people, especially colleagues. And usually you don't protect yourself when you are with colleagues.
And describe for me what that terrible combination of a really rapidly spreading virus and doctors and health workers being infected at the same time, what sort of pressure is that putting on your health service, your hospitals?
It's putting a lot of pressure. Why? Because a health worker with the virus can transmit it also to the other people that the health worker is supposed to take care of, to cure. And some of these people are elderly people with other diseases, so it becomes really dangerous for them. And you, health worker, you become like a vector for the virus to spread. And there is a lot of psychological pressure because you feel guilty because of that, but sometimes you can't avoid it because you don't know you have the virus. And the only thing is to use all protection. In our area now we say we are all positive. We believe we are all positive and we have to behave. If we are all positive, we all have the virus and we have to try to avoid to transmit it to others. You have two things to take into consideration. There are guidelines and there is psychological emotional status. So we are following WHO guidelines and which are saying that you need to use only surgical mask to take care of people with the coronavirus unless you do some invasive procedure that produce aerosol. So in that case, you need advanced masks, which are filtered masks. But nowadays, in our context, it is impossible to say so to my colleagues, to the health workers, because the fear is too high. And so everybody wants to feel protective as much as possible.
But also, sorry to interrupt you, but also you talk about the psychological impact. We've been running films from hospitals in your area. You can see health workers are doing absolutely everything they can, but they're also being forced to make very tough decisions about who they can treat and who they can't treat. They're seeing significant numbers of patients dying. I just wonder, what is the long-term psychological impact of that on them, on you, in fact?
Now we are in the emergency, so there is reaction. As you said, this impact we will see it later on, after the emergency, because now you don't have even time to think. You have just to act quickly. We have activated a psychological service in our hospital. For all the people they want to use it, our health workers, they can call and talk with the psychologists. But I believe, as you said, that this service will be even more important after the emergency, because right now you need to take care of everybody and run everywhere. Me, I have to stay isolated at home because I have the virus. I can spread it to others. But in my role of coordination, I'm working from home, trying to coordinate with my colleagues, with the institutions, and all the things I can do from distance. My colleagues are all running to take care of the people. But after this emergency, when we will realize what was happening, how many people died, and we have, as I said, we have a hospital, and next to the hospital there is a nursing home for elderly people. For these people, really, when they become positive, we can just give some support to them. We cannot even send them to intensive care units because above 80 years old, they can't go there in this moment. So this is very sad and painful for a health worker because your mission is to save lives. And right now, in some cases, you have to just give some support.
What would your message be to the UK? We're said to be 2 weeks behind you. What would you be saying to us now? What would your message be?
Stay home. Don't move, because this is the only way to prevent the spread of the virus. At the beginning, we were also thinking this is simply a flu. It's not a flu. It's giving a lot of pneumonia and it's very dangerous for a lot of people, elderly ones, but even younger ones. I have colleagues of 45, 50 years old in intensive care units. So the only way is to stay home. And for healthcare facilities, be prepared. Be prepared with personal protective equipment, much more than you think you need. And secondly, increase the beds for intensive care units and for infectious disease. These are all the only way for preparedness if you have enough time, and train, educate the health workers on the preventive measures. Don't give them for granted, because in normal times we forget those measures. So we need to be remembered all the time. Wash hands and don't cough on your hands, and use masks and all these things. You need to repeat and train every day.
And finally, do you see any light at the end of the tunnel, or when you look to the future, do you still feel fear?
I believe, at least in our area in Bergamo, the worst is happening now. So I believe after this, we cannot experience worse than this. So we will start recovering and coming out from this situation. From the people that are still waiting for this to come, you have enough time to prepare and in order for this to have less impact than the impact that it had on us.
Silvia Bignamini, thank you so much for talking to us today.
Thank you. Thank you.